Good morning all. The topic of presentation is periapical disease. I am myself Dr. K. Vishnu Prasad, Assistant Professor, Department of Conservative Dentistry, Chettinad Dental College and Research Institute, Kelambakam. Introduction. Traditionally, endodontology includes pulp and periapical biology, pathology. Clinically, however, endodontics is perceived as a treatment of root canal with the files and placement of root fillings, treatment by surgical endodontics. The vital pulp and the treatment measures to preserve the vitality are usually considered as a part of conservative dentistry. In both principle and practice, it is considered to be necessary. When there is an initial diagnosis and difficulties associated with the treatment may be related to the state of pulp and prevention and elimination of infection of root canal systems. Coming to this, it is a root associated where it involves periapical regions and periapically it is massive involvement. Of the endodontic disease, apical periodontitis is therefore prominent as it is a primary indication for the root canal treatment because it is by far the most common sequelae when treatment is inadequate or fails. This is the common sequelae of pulpitis followed by means of apical periodontitis, acute chronic stage, followed by means of periapical abscess, periapical granuloma, periapical cyst, osteomyelitis, acute chronic infection, periodontitis, and followed by means of abscess formation. Finally, it leads to infections and phoenix abscess. What is apical periodontitis or apical infections or apical disease? Apical periodontitis is a type of periodontal disease that presents itself as an inflammation in the area around the root or root of the tooth. This inflammation is usually one result of necrosis of the tooth pulp chamber. Body's natural defenses react to neutralize the foreign, but the result is major tissue damage to the surrounding tissues. The dead neutrophils antibodies along with the enzymes they release results in breakdown of tissue surrounding the root of the tooth, contribute greatly to the conditions. Classification, it is classified WHO classification followed by means of initial apical periodontitis. What is initial apical periodontitis? It is intracanal biofilms and microbes invading from the apical root canal into the periapical tissues. It is formed by means of pain, tooth elevation, tenderness on pressure on the tooth or the primary acute apical periodontitis. This is initiated by typical neurovascular response of inflammation resulting in hyperemia, vascular congestion followed by edema of periodontal ligament and extravascular neurophytosis. Coming to it, the later attached to the area of chemostatis induced by initially by tissue injury, bacterial products LPS and the complement factor C50. As the integrity of the bone, cementum and dentin have not been distributed, the periapical changes is undetectable radiographically. The if non-infectious irritants have induced inflammation, the lesions may be sustainable, the structure of apical periodontia may be restored. If microbial infections has initiated the inflammation, the PMN not only attack the microbes but also release the uterine prostaglandins. Self-induced destructions of the tissue prevents the spread of infection or to the other parts of the body, provides space for infiltration of the different cells. During the acute phase, the macrophage also appears at the periapex. Activated macrophages produce variety of among pro-inflammatory cells. What is periapical pocket cyst or phoenix abscess? It is a pathological process leading to the development of pocket cyst. Probably starts with the presence of microbial film in apical portion of root canal. Microorganism attract neutrophil granulocytes by chemostasis, proliferation epithelium that happens in immediate neighborhood of the regions. Periapical pocket cyst is a microabscess from the periapical meatus, and it is a cyst enlarged by accumulation of debris, necrotic tissues in the quantum epithelial cells. Persistent infection is due to intraradicular microorganism which is present in the regions. When the root canal treatment is done properly, healing of periapical tissue usually occurs with a hot tissue regeneration. Clinical manifestation, acute apical periodontitis by definition of minimal or no radiographic changes. The acute apical periodontitis is a primary cause and may occur in both vital tooth as experience occlusal trauma of the region. Root canal instrumentation focus in bacteria, extension of obturating materials, over obturation, perforation of the root, over instrumentation, forcing of irrigants and medicaments to the apical foramen. Symptoms, pain and tenderness to percussion, tooth may feel extruded and patient may have pain on closure and mastication. Pain on percussion is a classical diagnostic features. Radiographic examination is by means of pulpless teeth or normal periodicular structure of the vital tooth. Histopathology inflammatory reaction occurs in apical PDL fibers, characterized by means of dilated blood vessels. Treatment consistent determining of cause and relieving of symptoms associated with the vital or pulpless tooth, adjustment of high proteins, prognosis favorable. During acute phase of the apical periodontitis, the infection may develop to produce accumulation of pus and formation of abscess, which is nothing but a phoenix abscess or acute periodontitis with abscess or acute abscess conditions. There is increases in tissue pressure, bone resorption is initiated by inflammatory mediators and the pus escapes as the first to the bone and entering the periosteum. The exact location of the accumulation is not clearly known. Presenting symptoms will vary according to the stage of progression of inflammatory process. As pus builds under the periosteum, the pain increases its intensity and can cause its gaseous expansion of the regions. This is the pictorial representation how the abscess gets accumulated and gets exaggerated within the periapical tissues. Diagnostic that there is no response to thermal and electric sensorimeters. Pain on percussion, palpation is edited, which can be sometimes be severe depending on stage of processes. Radiographic finding, stage of development of abscess determine the radiographic pictures. At the early stage of abscess formation, radiographic signs of inflammation may be minimal if any. As abscess spreads and more bone in the radiograph, signs of periapical periodontitis will be granulated. The treatment principles are same as that of all the apical periodontitis. Apical periodontitis with sinus tract formation is due to excess inflammation, which coming through by means of sinus tract infections. The formation of sinus tract may be mechanism with which the body controls the infection, or it may indicate the specific infection of some as a known bacterial combination. Formerly, the sinus tract will drain on the mucosa adjacent to the offending tooth. However, the opening may be some distance of involved tooth or drain to the periodontal ligament, mimicking the periodontal ligament cyst or pocket. Present in symptom when the sinus is present in conjugation with the apical periodontitis, pain is absent or very mild, and swelling is minimal. This is due to lack of pressure built up by periosteum or adjacent tissues. Tooth is non-responsive to thermal or EPD test. There is no little light pain to percussion on palpation. Radiographic findings. Radiographic evidence of chronic apical periodontitis is usually present, but the location of sinus tract on mucosa does not always correspond to the offending tooth. Devascularization is nothing but a regeneration of the tissues. It is mineralized tissue and some fibrous connective tissues. No pulp-like tissues characterized by the presence of odontoblasts. Compare development of the root and the healing of periapical inflammation of inflamed teeth with radiographic taken in 1, 4, and 6 weeks. Surgery of the raising. Hereby I conclude the cause of presenting condition must be also assessed. The appropriate treatment will become obvious. Thanking you. At times we have many options, but we have to choose which among them is the best. Okay. These are my references.